Hello, welcome to Regard, Regulatory Guidance for Academic Research of Drugs and Devices. I'm going to talk to you about significant risk and non-significant risk of an investigational device. So we've provided some guidance here in Regard on determining risk. Is my study significant risk or non-significant risk? And the best place to make this determination is to go directly to the source. And by that I mean going to the Code of Federal Regulations, Title 21, Part 812, where all of the components of an investigational device exemption can be found, including how to determine significant risk or non-significant risk. So let's go to the Code of Federal Regulations. There's a couple of ways that you can get there. I prefer to go to the FDA website, to the home page, and in the search, type CFR. Okay, so here's the Code of Federal Regulations. Section 812 deals with IDEs. So specifically, we want to look at significant and non-significant risk. So let's go to the definitions section. So we're in Part 812.3 definitions, and let's go down and see what the law says about significant risk. So if we come down here to Part M, significant risk device means the following. So if your device is intended as an implant that presents potential or serious risk to the subject, or if it's a life-sustaining or life-supporting device, if you're using your device on its own to make a decision on diagnosing, curing, mitigating, or treating the disease, meaning that you're not using a standard care or secondary method to make your assessment, or if the device presents any other potential serious risk to the health, safety, or welfare of the subject. This is what the FDA is going to use in their determination of whether or not your device meets significant risk. Non-significant risk is anything that is not significant. Pretty simple. Now, I often get questions asked by investigators as to invasive, whether a device is invasive. And a little bit further up in this guidance is the legal definition of what is considered non-invasive. So something is considered non-invasive when it does not do the following: when it doesn't penetrate or pierce the skin or mucous membranes, ocular cavity, or the urethra. And if it does, it shouldn't enter beyond the external auditory canal, the nose beyond the nares, the mouth beyond the pharynx, anal canal beyond the rectum, or the vagina beyond the cervical os. So this is the criteria that you need to use to determine if your device and the manner in which you plan to use it in your study is invasive or non-invasive. So I hope this has been helpful in helping you to determine whether or not you have a significant or non-significant risk device. And thank you for visiting Regard.